2020 is in the books, but the lingering effects of a once-in-a-century pandemic will extend far into this new year. We've brought you several interviews in recent months about the efforts public health officials take to be on the front foot in fighting disease. And the challenges posed by COVID-19 were not unexpected by my guest tonight. It's Dr. Georges Benjamin, Executive Director of the American Public Health Association. Dr. Benjamin, thanks for being with us again. Appreciate your expertise as always.
I'm glad I could be here.
Now, Dr. Benjamin, COVID, of course, is nowhere near over, but our public health sector has to look ahead and look at the possible, quote, next one, if you will. To what extent has COVID and the experiences we've had with it made our system better prepared for large-scale health emergencies?
Well, I think one of the more interesting things that has happened is we have been struggling for some time about how to, make vaccines differently and faster. I think we've learned a lot about the science of making vaccines in real time. I think we've learned a lot about how to remove the bureaucratic barriers to making therapeutics and vaccines available to the public. And I think that's one of the real lessons from this terrible, terrible outbreak is that we can actually do that.
So the vaccines get a check in the good box, but what about maybe messaging? We can learn from the trouble we've had from a public health messaging standpoint, because at some point, too, you might expect another respiratory type illness to come about.
Well, the messaging has been terrible, and clearly we have learned the danger of politicizing the response and the politics. I think that's one of the most important lessons that we've all learned. Now, the truth is we knew that before this happened, but I think seeing this actually happen in real life lets us now understand how dangerous it is, because quite frankly, the fact that this has been politicized, particularly the issue around mask wearing, that has resulted in just so many unnecessary deaths and unnecessary infections. Now, I also think as a part of that, we have to acknowledge that we often think we know things, and we've learned a lot about the evolution of science in one of these things over time. So reminding everyone that initially we felt that wearing a mask wasn't that important and that we should focus a lot on the healthcare providers who are in high-risk infectious situations wearing N95 masks, but that the routine wearing of a cloth mask wasn't that important. Well, it turns out that's, of course, not true. We've learned a lot more about this, and that's based just on, lore and old studies and just public health beliefs that turned out, at least in this particular situation, not to be true at all.
I like that you brought that up, because people have looked at the changing advice you just talked about and they've said, see, they don't know what they're doing. They're making this up. They want to restrict our lives and all the sorts of rhetoric that we've heard. Do you think we also need to try to educate people about how science progresses and knowledge, and it's not a destination at the start, essentially, that you're going to have to go through a bit of a journey to find out what's going on, and sometimes advice and what we think are answers will change?
You're right. The issue here is figuring out how we do a better job of communicating to the public the evolution of knowledge. And, there was a time when everyone believed that the earth was flat and that if you went out there, you would just fall off the edge of the earth. It wasn't really until we actually put a man in space that we could actually take that photo and show folks that the earth was truly round. And that was during my lifetime. So even though we understood the science over time, that's an example of where science has changed. But that took hundreds of years, for that to happen. I think what we saw in this terrible, terrible pandemic was our knowledge base evolving what I would call fast science. We learned stuff very quickly over time, and we had to apply that. And we have to do a better job of telling people what we know, cautioning them what we don't know, and then moving on. One of the things that's happening right now is that we have this virus is mutating, And while the early evidence is that it is more infectious, not more lethal, and that the vaccine will probably work, that we're dispensing right now, the answer is probably and most likely. And we have to prepare the public for the fact that while we will vaccinate everyone very quickly, we hope, and we will get containment of the disease, we might have to come back and revaccinate in 1, 2, 3, 4 years. We don't know, but we need to prepare people for that.
Doctor, last question, and speaking of the vaccination effort, I remember a story of smallpox vaccination in the 1940s in Manhattan, and I think the quote was that it was about a week for everybody in Manhattan to get the smallpox vaccine because of an exposure. What do we have to do from an infrastructure standpoint to sort of ramp up the speed with which we can get these vaccines into people?
We need to really build a sustainable public health system that can identify when any kind of new health threat enters the community, whether it's infectious or non-infectious, and then understand it and eliminate it or mitigate it the best we can, and then go on. And we have not built such a system. That requires people who are well-trained with the proper technologies, and those technologies increasingly have to be ahead of the curve, not behind the curve.
All right, well, maybe 2021 will show us some surprises in terms of being on the front foot with this stuff. It can't be, well, I shouldn't say any worse than 2020, but you never know. Dr. Georges Benjamin. Let's hope not, right? Dr. Georges Benjamin from the American Public Health Association. Sir, as always, we appreciate it.
Thank you. I'm glad to be here.
And we'll be back after this.